70 years of workplace health and safety. When people think of risks, especially within FM, they think about risks to their health and safety, but the importance of health and safety in the workplace cannot be underestimated. While progress has been made, many businesses still fall short of this moral obligation and ensuring staff aren't at risk of injuries at work. Health and safety policies continue to improve around the world year on year, with fatality and injury numbers gradually decreasing at steady rates. Looking back at the past 70 years, health and safety was not always a priority for businesses or even their employees. As people across the country celebrate the Queen's Platinum Jubilee year, Alcumus have taken a trip down memory lane at how health and safety has evolved over the last 7 decades. Over the 1950s, the need for post-war reconstruction was urgent, requiring an expanded labour force to help the UK's economy get back on track. Work was very dangerous in many industries, and, given the absence of any health and safety regulations, workers suffered severe health problems as they were exposed to a variety of dangerous substances or hazardous chemical agents. It was estimated that there were about 20,000 cases of dermatitis a year over the 1950s, around 4,000 of which were a result of miners' working clothes being impregnated with coal, dust and oil. This meant an average of 4 weeks of work each year per case. However, towards the end of the 60s, it was estimated that the workplace-related injuries had increased from 450,000 to over 513,000 due to lack of regulation. These numbers served as another wake-up call to the government, acting as a strong basis for unions to call out for stricter regulations to be introduced. Then came the 70s, a decade of change. The UK went through changes in currency and saw the emergence of frequent labour strikes. Trade unions started to pressure the government to expand the industries covered in the Factories Act 1961, which subsequently led to the introduction of the Health and Safety at Work etc. Act of 1974. As the Act became law, the reporting of serious incidents became compulsory from the 80s onwards. With a lack of health and safety regulations around hazardous materials, deaths of those working with and around asbestos in particular peaked in the 1980s. Following various strikes by trade unions, statutory bans on the use of blue and brown asbestos by various businesses was introduced in 1985. By the early 90s, following a public outcry for improved regulations, various organisations started to take on more responsibility of their workers' health and safety. This was reflected in the drop of serious fatalities towards the end of the decade. According to the HSE, in 1999 and 2000s, the final number of fatal injuries to employees in manufacturing saw a decrease of 43%. In 2005, the work at height regulations were introduced, marking a pivotal moment for those working at height and the construction industry as a whole. Proper training became a necessity, and a shift towards taking a more careful, considered approach to working at height began as awareness around the importance of health and safety continued to rise. Recognising the need for competent advice, in 2011, the Occupational Safety and Health Consultants Register was set up by the government to ensure that businesses had access to quality advice from health and safety practitioners, which were accredited to one of the professional bodies in the industry. As the world battled the impact of the COVID-19 virus during the last couple of years, the importance of having effective health and safety procedures moved to the top of every organisation's business agenda. To read more, visit our Safety and Health category.
Read more at TWinFM.com.